Hey community, this is Dr. Hugh. I want to go over this question right here, which is actually a really, really good question. So I love your question. So if you have a question, just put it in the comment box and I'll try and get to it. But this one was about brain inflammation. A couple of posts back, I talked about, your brain's inflamed. You have neuroinflammation. And then Steve asked, what's the causes? So I'm going to go over, the top 2 or 3 major causes. Number 1 is concussions. Now, this doesn't need to be when you're knocked out. You don't have to be knocked out like an NFL player. That's not the concussions that we're talking about. We're just talking, did you have your bell rung? Did you, when you were in high school, did you fall on some ice and hit the back of your head and you woke up and your breath was kind of taken away and you might be seeing spots? Maybe you got in a car accident, you got rear-ended and you had whiplash and your head went back like this. Maybe you've had a couple car accidents. Maybe you've had something significant and you had a car accident and your head hit the windshield. Right, so when I talk about concussions, we're not talking about where you're out cold and you don't remember. We're talking about microscopic trauma over a period of time. So it could be repetitive, small traumas. So if you played a lot of sports, it could be like a volleyball player just heading the ball, or a soccer player heading the ball. My son plays basketball or soccer. So just heading the ball repeatedly for 10 or 15 years. So that's number 1. So if you've had these concussions, your brain's inflamed, then there's a whole protocol for that, but I'm just talking about reasons why. Second reason is your gut. If your gut's bad, now you should be making 2 to 3 bowel movements every single day, no gas, no bloating, diarrhea. If you have something then other than that, your gut's inflamed. Now you have a leaky gut. Now your gut barrier and your brain barrier are almost identical. So if you have a leaky gut, you have a leaky brain. So right there, that's going to be neuroinflammation. Now how do you handle that? I tell people, if you want to really handle it well, start with going a carnivore-ish diet. That means you're eating meat and fruit. That's what I recommend for 4 weeks. Hey, if it works, great. Then you know you had some kind of leaky gut and food sensitivity. Do that. Third thing is that you have some food sensitivities, such as wheat, soy, dairy, and eggs. Wheat, soy, dairy, and eggs. So that eliminates a lot of foods. That's why I tell people, go on a carnivore diet and just eat meat and fruit for 4 weeks and see what happens. And guess what? Most of my clients are like, dang, this is incredible. Why? Because you've eliminated all the food sensitivities. You've calmed down your gut. You calmed down your breath. If you calm down your gut, you've calmed down your brain as well. So this is really, really critical. And just a couple bonuses for 3 and 4 would be magnesium. Take anywhere from 400 to 1,200 milligrams a day magnesium. I like it if people sipping it. Vitamin D. Make sure vitamin D is around 80, not 30, 80. That's key. So if this helps you, good. And if you want any more help, you can look at my bio. Take care. Bye-bye.